Have you ever pulled something and wondered, have I sprained it or have I strained it as well? And what's the difference? More importantly, on top of that, what should you do next? So today we're going to dive into the differences between your sprains and your strains, also how we grade them and the ways that we treat them, how that's evolved from the old school RICE, the RICE method, to the more modern approach that you might not have even heard of yet. So I'm Scott Woodhead here at Sports Physio UK. And as a practitioner, we see sprains and strains every single day. They come from the pitch sides, patients from the gyms, and just from everyday life as well. Now, we don't just treat the injury, we help you recover and be stronger. So let's start at the top, really. First things first, what's the difference? So a sprain is an injury that encompasses a ligament. That's the tough, fibrous tissue that connects bone to bone. Whereas a strain, that affects a muscle or a tendon. So the tissue that connects the muscle up to the bone. So think of an ankle sprain versus a hamstring strain. One's joint stability issue. The other one is a muscular issue. So let's talk about grading then. So not all injuries are the same and we have to look at that properly. So we grade them here in clinic and we'll look at 3 grades. So grade 1, it's a mild overstretch or just a minor tear. You might feel some discomfort, but usually you can move on. Grade 2, that's a partial tear, a bit more severe, more painful, a bit of swelling, some weakness and or stability as well, depending on whether a ligament or a tendon. And grade 3 is a complete rupture. We're talking severe pain, sometimes no pain at all if there's a major tear, a complete loss, but there's big amounts of swelling and instability. Now, grade 1 and a 2, that's us, we deal with that. Grade 3, we will still deal with it, but you need a consultant as well. Now, about the ice pack, you've heard of RICE, compression, elevation, etc. As Gabe Merkin from 1978, but Rehab's evolved and we use a different acronym now. So if we move forward to 2012, Dr. Phil, they used police, protect, optimal loading, ice, compression, elevation. And then that shifted into optimal loading, getting the body moving as soon as safely possible. But then it developed again, 2019. Dubois and Asculia went a step further with peace and love. And it's a person-centered. So if you follow what we do, we like that whole body approach. So let's just break down that peace and love because they are 2 very different things. So peace looks at that early phase, that protect, you stop it moving. Elevate it, we reduce the bruising, avoid the anti-inflammatories. In the first 48 hours, look at your NICE guidelines. Compress, so we still do that, and we used to do that years ago. Reduce the swelling and educate. Listen, give the education, you guys need to listen to it. Later on, we look at love, and that's loading. So walk or move if possible, normally if it's a grade 1 and possibly grade 2. Optimal optimization, vascularity, so increasing blood flow to the area. We work on, and exercise, exercise. We work on the sciences. So if you've rolled that ankle, you've tweaked your hamstring, you need clarity on what's hurting. And you need to know maybe what's actually happening. You want it grading, where we come in. So it's a bit of a whirlwind tour of sort of your gradings within your strains and your sprains today. But if you want more, you're struggling, there's only one place you need to be going. And that's onto our link down at the bottom. Book online 24 hours a day, or just give our clinic a ring. We're more than happy to help you. We look forward to helping you. We'll see you soon here at Sports Physio UK.